All right, so our coronavirus update from Johns Hopkins University. Total confirmed cases worldwide now 1,284,000. That's up over 250,000 since Friday. Total confirmed deaths now 70,000. That's up 16,100 from Friday. Total confirmed recovered 271. 5% of active cases are considered serious, steady from 5% on Friday, down from 19 back at the high in February, and 11% of U.S. confirmed cases are still requiring hospitalization, roughly on par with Italy at 12%. Spain, 17% are requiring hospitalization. We now have 336,851 new confirmed cases. That is up almost 100,000. On Friday, I gave you the death count of 6,000. Today, it is 9,620. We now have about 1% of the population tested. They're saying now, according to the New York Times, that the U.S. death toll is off a bit, only by about 100%. COVID-19 deaths in the U.S. may be undercounted by half. Inconsistent protocols, limited resources, patchwork of decision-making have led to an undercounting of people with the coronavirus who have died. Let me give you a couple of examples from the New York Times. First one, a coroner in Indiana wanted to know if the coronavirus had killed a man in early March, but said her health department denied a test. Example 2, paramedics in New York City say many patients die at home are never tested for coronavirus, even if they showed all of the signs of infection, with death certificates marked as cardiac arrest, respiratory failure, or unknown. And example 3, in Virginia, funeral director prepared the remains of 3 people after health workers cautioned her that they each had tested positive for coronavirus, but only one of the 3, had COVID-19 on the death certificate. We definitely know there are COVID-19 deaths that are not accounted for. That's across the country. They say that it's 100% off. The same effect has occurred in Italy, Spain, Ecuador, and China, where the rate at which patients are dying and lack of testing led to chronic undercounting of COVID-19 related deaths. As reported by The Blaze last week, citing the Wall Street Journal and Al Jazeera, Ecuador healthcare officials in some areas have taken to burning bodies in empty parking lots or burying bodies in mass graves, with most of the deaths never tested for COVID-19. In one Italian village, a mayor reported he had more than 300 bodies, presumed COVID-19, which officials had not picked up or counted in Italy's official numbers. The army told us on Friday, then Sunday. We're still waiting, he said. Virus can contaminate face masks up to 7 days. Oh, geez. Have we decided on what the face mask thing is, Stu? Are we?
They did a national recommendation that when you're out in public, you should wear them. However, they also say that you need to be washing them, because if you just keep popping on the same one or handling the mask after you've used it, there may be virus on the mask anyway, so it's not really going to do you much good. It's like one of my favorite parts about, look, there's not a lot of positives coming out of this, but one of my favorite stories was the fact that now all of these grocery stores are banning the reusable bags and going back to the disposable bags.
I love that.
Because
I love that.
because of, the virus, which, it's funny because this has been a legitimate problem for a long time with reusable bags, because people take their bag and they put the meat in the bag and the juice or whatever leaks out and it, does all the stuff.
You're supposed to wash it every time.
Every time. And the fun part about washing it every time is it eliminates any environmental positive that you would get. So if you don't wash it every time, there's a slight environmental positive, though you're risking your health in serious ways. If you do wash it out, it's worse for the environment than plastic bags.
So no big deal. No big deal. So your face mask could be effective for 7 days, but don't worry about it. The fact check from USA Today I found interesting. Finally, they got around to this one. Did Obama deplete U.S. national stockpiles of N95 masks? Did you hear this? If you're a conservative, you probably heard this. If you're a liberal, you probably didn't hear this. Yes, according to USA Today, now they've finally taken up the task. He geared us up for swine flu and hurricane and flooding cleanup operations in 2009 and then again in 2012. They used all the N95 masks, or a lot of them, and then never put them back in stockpile. So didn't replenish. That's one of the reasons why Donald Trump, he's so bad, we don't have any masks. Yeah, that would be somebody didn't put more on the shelf. That would be Barack Obama.
Yeah, there actually is an interesting story today, too, about how George W. Bush was obsessed with pandemics. He read the 1918 flu pandemic book, which we've talked about before. It's a pretty, it's probably the
great
biggest
influenza. It's great.
Yeah, it's probably the biggest, well-known, best-known book about in 1918 flu. Yeah. And he read it and was like, look, this is serious. We need to be prepared for it even when we don't see it coming, because right around when it hits, it's going to be too late. And he spent tons of time and resources preparing the U.S. government for this. And then it was whittled away by, largely Obama. I mean, it was really a big deal to Bush personally. It was abandoned once Obama took over. And, you could make the argument that Trump should have, brought all these things back in his first 3 years. There's not, there's no blameless person here overall, but still, Obama seems to be the one who really did not prioritize this as much as you would have hoped throughout this, and it's costing us.
Well, it didn't prioritize, quite honestly, anything. I mean, when it comes to disaster, you don't have a stockpile and then not replenish it. If you're using it, you have to, at the end, go back and replenish, and they didn't. And I don't blame Donald Trump for that, and I don't blame Obama for not carrying through with George Bush's thing. I do blame him or his administration for not replenishing it. That's your responsibility. I mean, we all learned that with our moms. Can somebody, you just want to replace the toilet paper, or is that all I live for, is just replacing everybody's toilet paper? There's a new roll underneath the sink. I mean, we all got that from our mom. That's exactly what Barack Obama should have heard. Latest casualty, as we told you earlier today, Corona beer has officially stopped production. No, it's not that we're that stupid. Mexico has finally gotten a clue and said that that's not an essential business. I think there'd be a lot of people that would disagree with that, but they have shuttered the beer business. Japan and Hong Kong may declare a new state of emergency because the virus has re-emerged. Both Japan and Hong Kong saw new waves of COVID-19 cases as travel and work restrictions were lifted about 10 days ago. This couldn't be worse news. And then the Surgeon General came out and said this is going to be the hardest and saddest for most Americans' lives. He said this is going to be the grimmest period of the COVID-19 pandemic in the United States. This is, quote, going to be our Pearl Harbor moment, our 9/11 moment. It's going to be localized, and it's going to be happening all over the country, and I want Americans to understand that. I want Americans to understand that as hard as this week is going to be, there's light at the end of the tunnel. Do you have that feeling at all, Stu? That this is going to be the hardest, most grim...
Or I thought you were going to say, is there light at the end of the tunnel is what I'm feeling.
Yeah, no, I mean, do you feel like it's that? Like, do you feel this, what he was saying?
Well,
because I don't.
We're seeing thousands of people die a day. I mean, remember the beginning, your whole, what did you said this, I think, last week. It's currently the third largest cause of death in America, right? Did you say that right now it's third?
Yes. And if it just stayed stable, didn't grow, just stayed stable, by the end of the month, it would be the number one killer.
The number one pandemic in the last 100 years. The number one
pandemic last 100 years.
Yeah. So, I mean,
that's pretty remarkable.
It's been pretty significant. I mean, especially my situation's different than probably most of the people listening, in that I'm still coming to work every day. Like, I was talking to people this weekend they were like, wait, what? You're still going in? Like, how is that possible? In a lot of parts of the country, it's not like it is in New York, But I mean, there are several major cities who are about to go through the same thing that New York is going through. We've bought a little bit of time, hopefully, and some of the resources will get to the right spots. The president was pretty upbeat about getting the right amount of ventilators and such to each location. Hopefully that can actually happen.
Seattle's sending their vents to New York, which is great.
Yeah. I mean, so hopefully, I mean, I do have a lot of confidence that when the United States decides something's a legitimate thing to focus on, we do pretty well at it usually. You know, it takes us time sometimes to pick these things up early. We talked about this with terrorism, right? Like, you know, we were not necessarily taking it seriously for a long time. And then all of a sudden, one Tuesday morning, we all kind of like, holy crap, this is a really important thing. And we took it very seriously after that. And we tend to do those things, you know, when we really put our mind to it, we do pretty well. And you could see like the way that these companies are coming together, making, you know, building the masks and the face shields and ventilators. And, you know, the testing is another one. I keep spouting this and no one seems to care about it. It's because it was a narrative apparently 2 weeks ago and no longer applies. But the idea that the United States had basically no tests at all 3 weeks ago and is now doing 150,000 a day. We're up close to 2 million tests already. We've tested now more than any other country, you know, and who knows with China, you throw them out because you don't know. But we've stepped that up quickly. We have these rapid tests coming, and between that and the potential antibody tests, you have a situation where we could get a handle on this and operate our country in a relatively somewhat normal fashion, even before we get a cure or a treatment.
You know, it's amazing because I told you, I think on Friday, that I watched Sky News from England. And there were two stories that stuck out right at the top of the hour. One was the private sector saying, please let us make ventilators, let us make masks. The private market was begging the government to allow them to make medical things, and the government wasn't doing it. The very next story was the government's, and look it up, it's unbelievable, the government's five-step plan to be at 100,000 COVID tests by the end of this month. What? The five-step plan? I mean, holy mother, you're kidding me. We're doing 1 million a day. And we were the country that was, we have no clue as what. No, this is the capitalist system.
Yep.
This is the capitalist system.
And, you know, there's this thing going around about how, there's no libertarians in a pandemic. It's the opposite. Everybody turns into libertarians in the pandemic. The most left-leaning, I want big government people all see when it gets really important, they get rid of all those dumb restrictions, all the licensing issues, all of the long approval processes. You know, there's these things we talked about, Glenn, a little bit, certificate of need laws, which are laws that say, hey, when you want to build a new hospital, you have to go to the state and say, I think they need a new hospital. And the state has to tell you, yeah, we agree with you, after hearing the opposing opinion from people in the community who know best, namely the competition you'd have in the hospital that already exists. So they come in and they, of course, don't approve a lot of these hospitals. The same thing goes with, important medical equipment like MRIs and ventilators, right? So they go through this. They had at one point, 49 states had these. They started to whittle away as Reagan went on. But I think it was at something like 36 states when the pandemic started. I think it's 15 of those states, most of them, most hard hit by this pandemic, have all waived those laws now so that people can bring in more beds and can bring in more ventilators. But it does very little use once the pandemic has already begun. Like, if you had an open system and there were enough beds there already, you wouldn't have to worry about these things last second. Instead, they're bringing ships in off the coast.
These are the kinds of things that you will learn about in Arguing with Socialists. The new book, it comes out officially tomorrow. You can order it on Amazon right now. I think this is really important to make this a #1 best-selling book, even top 5 best-selling book from the New York Times. It would send a real message this week in the pandemic if everybody's like, oh, no, we want government. No. Arguing with Socialists. Buy your copy now and get it wherever you buy books.